Hello everyone, my name's Sarah and I work for Tackle Prostate Cancer, and it's really great to be here today, and it's really fantastic that so many of you have taken some time to join us. I've now been in post for 6 months, and during that time the one topic that comes up again and again is how groups can reach more members and grow awareness of the support they can offer to people at crucial points along their cancer journey. I've often heard how sometimes it can feel like we've got a mountain to climb, but as we've just heard from Mukti, you're not alone. By being clear about your vision and your ask, this can help you network and work in partnership with a variety of stakeholders. And by stakeholders, I mean other groups, networks, and individuals, all who have an interest and a vested interest in being part of our community, who want to improve the lives of people living with prostate cancer. Mukti has already talked this morning about engaging with healthcare professionals, and I'm going to now spend a little time talking about the wider networks in your localities that can help you raise awareness and spread the word about the amazing work you do and the support you can offer to people, as well as the awareness you can spread of prostate cancer in the wider community. Getting to the top is always easier with friends. We all need help sometimes to get where we want to get to, and never more when what we want to achieve can often seem out of reach. When preparing for anything, whether it's an unfamiliar journey, whether it's a mountain to climb, or just a trip to the shops, you have to have a plan. So you think about what is your purpose of the journey, and that goes back to what Mukti has already said about having a plan and being clear about your vision. You need to think about what help you might need on your way, what resources you might need. Things like leaflets, social media posts. A really good resource to think about is case studies and people's lived experience, the stories of people who are benefiting from the support you give. This can really highlight and show the value of the support that you can offer. You might ask someone who's already done the journey before and what helped them get to the destination and realise their vision. And in the case of raising awareness and promoting your groups, there are lots of people here today that have already been on the journey. And as I have often said over the past few months, knowledge is already in our network. And one of our objectives for these events over the next 2 days is to begin to share that knowledge and learn from each other. So I think there are 3 main groups of assets that you might need to draw on your journey, and I'm going to spend a little time focusing on each in turn. It's important to remember that we recognise that you're volunteers and therefore your time is precious and often limited. So please do not feel that you need to draw on all of these assets all at the same time, or even all of them. It may be just by linking with some of the assets in one of these groups enables you to promote your support group to a wider audience. Remember also that some places have better resources and accessible assets than others, and this is often down to local infrastructure organisations and how they're managed. As we move towards a more people-powered model of health and well-being, with concepts such as social prescribing, there has been a growing movement to bring together community assets along with statutory organisations. This has meant that people in the NHS and elsewhere are becoming much more aware of the value of peer support groups, such as the ones in our network. Again, one of the positive outcomes, we have to look for the positive everywhere, or at least I do. One of the positive outcomes of the last 12 months has been the coming together of community assets into the mutual aid groups that have been able to support people throughout the pandemic. We start first with community assets. They come in many, many forms. Thinking about people and groups, and often our biggest assets are hiding in plain sight. Your members are probably linked with lots of groups. Do you know who they're linked with? This is often a good place to find local networks. We often need to do more to increase the diversity of the groups and make them more reflective of our localities. So reaching out to faith groups is another place to consider. Temples, mosques and churches are all often keen to take up the opportunity of events that can focus on both men's health and health in general. And that in turn can signpost people to your groups. And as we know, partners are often the first to encourage men to seek support. So promoting groups to women's groups can often be useful. Some groups have already done some fantastic work. Alan Taylor on the Isle of Wight has done some great work with the Women's Institutes and has got some really good ideas on how to promote the work that you do through in this way. Other groups have links with Age UK, Men's Sheds, Lions Clubs and Rotary Clubs. All are great networks to link into. Also think about other charities. They often have workers that have really good networks that can support you. None more than Macmillan Engagement Leads and the Macmillan Information Managers. Macmillan Information Managers are often based at local hospitals. Sharon Hatch is here today and she's one such worker covering Whipps Cross and the Royal London Hospital. Most localities across the UK have Macmillan Engagement Leads. They can help you connect with local networks, and they can also be a really good resource for funding grants for innovative ideas and small projects. Think then about capital assets such as buildings. Leaving leaflets and posters and cards at community centres, church halls, finding out what other groups meet in those buildings, speak to centre managers, put some posters up. And then recently I've been noticing the proliferation of barbershops. I think there's now 3 on my high street. Again, another really good place to think about how you can reach out to them to highlight the work you do by putting up posters and leaving cards and leaflets. Again, theatres often have community outreach services. My local theatre, for instance, runs some groups for older people and people with long-term conditions. Again, posters, leaflets are all really good places. These are all really good places to leave those assets. And then thinking about cultural events that happen in your locality. And I recognise that planning anything for this year is impossible. I live in Coventry, City of Culture. We should have started in January, woefully nowhere near there yet. But think maybe now about starting to plan for next year, for 2022. Many larger towns and cities have a range of diverse festivals that celebrate local communities throughout the spring and summer. These are ideal opportunities to have a stand which can promote and raise awareness. And lastly, when you think about community assets, councils often promote various campaigns throughout the year. And again, these are really good opportunities to promote prostate cancer to wider communities through information stands. Moving on now to think about statutory bodies that you could link with. Mukti's already talked about promoting groups to healthcare professionals and cancer alliances, but there are many other bodies with which you can engage in order to raise awareness and promote the support. Across all of the UK, at all points of the system, health boards and care programmes in Wales, in England, strategic clinical networks, clinical commissioning groups, primary care networks, there are lots of groups and networks which promote patient and public involvement. Sometimes this is a tricky area to navigate. Again, think about the assets that you already have in your group. There may well be people that have worked in the NHS or worked in local government, and whilst they might not want to be a committee member, they might be welcoming of the opportunity to support the work that you do in some way. Think also about Healthwatch. Healthwatch is an independent national champion for people who use health and social care services. They're a fundamental part of the health system in England to find out what matters to people and help make sure that their views shape what they need. There is a local health watch in every area. Local health watch also find out what people like about the services and what could be improved. And then they share these views with those with the power to make change happen. They also host a lot of information about local services in the area. In Wales, the same job is currently carried out by community health councils, and these mirror the local health boards. Both Healthwatch and community health councils are a really key network to link up with. One thing you could consider potentially doing would be to promote your groups through highlighting campaigns such as Prostate Cancer Awareness Month or Men's Health Week. Probably least useful here are the health and wellbeing boards, who bring together local government and clinical commissioners and a range of partners to deliver more collaborative and integrated working. I mention it here really because some of them do have some very good networks, but again, it's all down to the local infrastructure. Last grouping are the local infrastructure bodies. These can be really useful as they can host information about your groups, signpost people to you, be a catalyst for bringing people, community groups like yours together. They can also provide access to small pots of funding, and really crucially, they can often provide training on areas such as equality, diversity, inclusion, safeguarding, committee structure, all sorts of things that can help you as a community group. They're called different things in different areas, but a quick Google search for Voluntary Action Bolton or Voluntary Action Bradford will normally bring up what the nearest sort of voluntary action infrastructure local to you. These infrastructure bodies are often the link to community hubs, local care coordinators, and social prescribing models in a locality. Social prescribing is the current big thing in health and social care. It enables GPs, nurses, and other primary care professionals to refer people to a range of local, non-clinical services that support their health and well-being. It is coordinated differently across the country, as contracts can sit with a variety of statutory and voluntary organisations. Essentially, it seeks to address people's needs in a holistic way. It also aims to support individuals to take greater control of their own health. Schemes delivering social prescribing can involve a range of activities that are typically provided by voluntary and community sector groups and organisations. So promoting your own community group to these structures can be really beneficial. So finishing where I started, the analogy that we have a mountain to climb. So I guess these are my sort of takeaway tips really. Going back to what Mukti said, you make a plan, you hone your vision, you write your elevator pitch and you learn it. Be realistic about your capacity as a group, as a committee, or as an individual volunteer. Reach out to us for support and guidance. Take small steps. Delegate, share the load, and then it goes back to those connections. Connect, network, and then connect and network some more. And above all, remember why you continue to climb. If you need a reminder, here are 2 quotes that I've collected in the last couple of months that highlight why what you do is so important. So on behalf of these men, the ones that attend your groups, the people past and in the future, your groups and your support will help. I should like to say thank you. And I'm just going to leave these here for a couple of seconds so that you can read them. Okay, thanks very much.